Download your favourite apps with Huawei Kettle Search. Download now.
COVID-19 alert level 1 from midnight Sunday. Hi everyone, Will here. Now I'm here in the newsroom for today's COVID-19 press briefing. We'll head to Wellington in a moment, where the Cabinet has been meeting with health officials to decide exactly that. Will we be back at alert level 1 despite still reporting another community case yesterday? We will obviously hear infection numbers as of the past 24 hours and also the existing case information, especially those 7 in hospital with the 2 in intensive care. Reading the tea leaves though, what can we say about that possible shift to level 1? Well, I hate to say it, but it's not looking particularly good. Earlier this week, the government talked up the fact that we could still move to level 1 even with community cases. However, some of the country's best epidemiologists and microbiologists have been doing the media circuit this morning, pumping the brakes on that. That includes Auckland University Professor Sean Hendy, whose modelling has guided the government's response. Hendy strongly advocating it would be best to keep the whole country at alert level 2 because we simply haven't had enough time to know how well level 2 restrictions are actually working. This Auckland cluster, obviously, as well, we know is our biggest yet. He says the other risk is the amount of Aucklanders travelling out of the city to other parts of the country who could basically take COVID with them. He goes on to say, quote, if we were at alert level 1, then an outbreak can grow very rapidly, whereas in level 2, there is still a chance it wouldn't take hold at all. Sentiment sort of backed up by Otago University Professor Nick Wilson. He said it's too soon to move down alert levels also, and recommended the government should actually be going harder, requiring masks in schools, workplaces and shops. He even wanted to see that adopted in other parts of the country, particularly in the healthcare and aged care areas. The Prime Minister weighing in too, she said that the idea we would move to level 1 would be, quote, a big leap, end quote. Make of that what you will. Beyond this potential alert level change, we may also hear a little bit about the 700 diagnostic lab workers that have gone on strike in 14 centres across the country for the next 24 hours. The union that represents the lab workers says there's very little chance it'll have any effect on the processing of COVID-19 tests at this stage, but they have had a 2% pay offer increase and they've rejected it, so it is not by any stretch of the imagination over yet. Also, we are of course coming up to an election, so expect to hear something from the Prime Minister on Winston Peters breaking ranks from the government position of how they were managing those isolation facilities. You know, the ones that had the 5 breakouts with the more than 10 people that got out in July. Winston arguing this morning with our colleague Mike Hosking that he'd wanted the NZDF at those facilities at the current numbers as far back as March. Of course, he didn't say it at the time, and he says he regrets doing that now. The Prime Minister pretty much shrugging it all off and putting it down to electioneering. At last count, New Zealand First was at around 2.5% in the polls. That's half of what they need to get the 5% threshold and make it back to Parliament. Unless, of course, they win an electorate, of course, so maybe she's got a point there. Oh, to be a fly on the wall in that cabinet meeting just moments ago. We can't do that for you. We can do a lot on Focus Live. We can't do that, but we can see what they've decided. Let's go now to Wellington.
Kia ora koutou katoa. Good afternoon. We'll start as per usual with an update from Dr Bloomfield and then move to an announcement on Cabinet's decision after reviewing our alert level settings this morning. But before I do, Dr Bloomfield.
Thank you, Prime Minister. Kia ora koutou katoa. So today there are 5 new cases of COVID-19 to report. 2 of these are imported cases that were detected in managed isolation, and 3 are community cases. All 3 community cases are epidemiologically linked to the Auckland August cluster, as we call it. The 2 imported cases are children who are family members of previously identified cases who had arrived from India on the 23rd of August, Both children are aged under 9 years of age, 9 years, and were already in quarantine with family members in the Auckland quarantine facility. Since the 11th of August, our contact tracing team has identified 3,191 close contacts of cases, and of these, 3,136 have been contacted and are self-isolating, and the small number of remaining cases are in the process of people are in the process of being contacted. There are 82 people in the community cluster who remain at the Auckland quarantine facility, and that includes 59 people who have tested positive for COVID-19 and their household contacts. That number continues to decline as cases recover and reach the end of their isolation period. There are 6 people with COVID-19 in hospital today, 1 in Auckland Hospital, 1 in Middlemore, 2 in North Shore Hospital and 2 in Waikato Hospital. 4 of these are on a ward and 2 are in ICU 1 in each of Middlemore and Waikato hospitals. Today there are 8 previously reported cases who are now considered to have recovered, and so with today's 5 new cases, our total number of active cases is 112. Of these, 37 are imported cases identified in our managed isolation and quarantine facilities, and 75 of our active cases are community cases. So our total number of confirmed cases is now 1,413, and yesterday our labs nationally processed 9,909 tests for COVID-19, and the grand total to date of COVID-19 tests is 797,990. And finally, on the NZ COVID Tracer app, it now has recorded 2,088,100 registered users, and there have been 355,668 posters created. And I should say that there have been over 35 million poster scans and 2.3 million manual diary entries. But another key point I just want to emphasise is that every one of those people who have downloaded the app and registered has provided us with their up-to-date contact details, which is extremely helpful for our contact tracing efforts. Thank you, Prime Minister.
Thank you, Dr. Bloomfield. Today you can see that our current position remains solid. At this stage, the Auckland cluster remains contained, and there is no indication at this stage that Auckland needs, for instance, to move back to level 3. We have built on what we've learned over the past few months. We've been prepared, and by going hard and early, and particularly with Aucklanders pitching in, we look at this early stage to have contained our resurgence. I want to recap today on some of the evidence that can give us some confidence, but also the areas which suggest caution is still very much required. First, we have undertaken nearly 300,000 tests since the cluster was detected, including 67,660 in the past week. That includes 61,800 in the community, 3,587 border workers, and 2,213 staying in managed isolation and quarantine facilities. Since the move to what I think we've all been calling level 2.5 for Auckland, we have had another 30 community cases, all associated with the cluster and detected in people identified as close contacts and already in isolation. Genome work has meant that instead of us likely considering this cluster as multiple unconnected groups of cases with all of the uncertainty that would hold, we know all cases stem from a single index case. Despite best efforts, every country has faced second outbreaks in this global pandemic, and some have turned into significant second waves. Everyone has taken that experience seriously, and here in New Zealand it has made a difference. In fact, I suspect that in time modelling will demonstrate what a difference level 3 in particular made to our response. And everyone has taken the most recent settings seriously too. Today we have considered those settings. As always, Cabinet looked at the same criteria for moving alert levels that we have had the whole way through, that we have containment of a cluster, that there has been compliance with the rules, along with the consideration of the cost and impact of restrictions. That includes, for instance, the fact that we have had 67,000 applications approved for the Resurgence Wage Subsidy Scheme, supporting 188,000 jobs and taking the total government investment in keeping people linked to jobs throughout COVID-19 to $13.7 billion. We also, of course, consider things like the increase of 1,500 people on the job seeker benefit and 1,200 on the COVID income relief payment in the week of the 14th to the 21st of August. Plus, 1,500 people in that time have moved off those benefits and into work during that period. But most importantly, we consider that the best economic response remains a strong health response. If we get it right, we ultimately shake off restrictions faster and lessen the risk of bouncing around. That means looking at what the health evidence is currently telling us. While I mentioned that we have not had any unlinked cases while we have been at level 2.5 in Auckland, there was one just prior to moving into that alert level. This is a case that while it has been genomically linked, we have not yet been able to determine the person-to-person link to our cluster. That means there could be other people we are missing. That has happened to us before, and it doesn't mean we can't contain the outbreak around them successfully. But it does give us reason to be careful, and it does give us reason to be cautious. Secondly, we have considered time. With going on just 5 days at these new settings, we don't yet know fully what the impact of our level shift will have been in Auckland and beyond. It is simply too early for us to know just yet. And finally, early modelling from this cluster shows that the greatest period of spread, the greatest period of risk during this cluster was over the weekends, the times when we gather, when we socialise, again showing the risk of too much of that too early. Lockdown must always be our last resort. We do not want Auckland or indeed the rest of the country pinging in and out of level 3. Staying on track to lift restrictions with confidence does mean taking a cautious approach now. That is what we have done consistently in our elimination strategy, and it's one Cabinet has decided to continue. That is why today Cabinet decided to retain the current settings with the next review to take place on Monday the 14th of September. If at that time a change in alert levels is made, it will be time to take effect from 11:59 on Wednesday the 16th of September. Some may ask why it is that the rest of the country will continue at level 2, as Cabinet has decided today. Early modelling suggests that even if cases had stopped appearing altogether several days ago, there is still a chance of spread outside of Auckland. If that does happen, level 2 settings lessen the impact of any spread. It means we avoid further fallout. What's happened in Tokoroa is a good example of how we have managed to do that. There have been cases, but level 2 settings have enabled us to contain those well and have stopped, for instance, any likelihood of the super spreader events which have caused such difficulty overseas. Some will ask why we lifted Auckland's regional boundary at all. The simple reason is that in a level 2.5 environment in Auckland, we are allowing people to see family, to go to school, to work, to visit hospitality venues, albeit, of course, whilst maintaining numbers up to, in those social settings, up to 10. Maintaining a border that says that you can do that in Auckland, but you cannot go outside of it, would be very difficult to enforce. It would also mean stopping anyone going into Auckland as well from any other part of the country. But that doesn't mean we shouldn't all continue to act carefully, to look after one another. And this is what this decision balances. The reality is that as the virus continues to circulate in the world, we'll need to be dealing with it in a number of ways. While we all want to get out of level 2 restrictions as quickly as possible, we only need to look at Melbourne to see what can happen if the virus takes hold, and equally what moving too quickly to lift restrictions could possibly mean. As with last time, a cautious approach is the best long-term strategy to get our economy open and freedoms back faster in the long term. So, to Aucklanders this weekend, do think carefully about your activities, stay safe, stick to your limits, and do it for all of us, because we need you to be open, free and safe too. We are again on the most perilous part of our alert level journey, the descent. Greater freedoms are within reach, but gains made can still be squandered if we don't follow the rules and play it safe. That is also why we will keep stepping things up. On testing, our message continues to be, get a test if you have cold or flu symptoms, no matter where you are in the country. In Auckland in particular, you'll notice a greater presence of health professionals in the community and availability of testing in more diverse locations, including, for instance, testing stations at Botany Town Centre. You'll see testing stations at places where there might otherwise usually have been religious worship. And you will see health staff visible at Auckland Airport Domestic Terminal to provide health information and to remind people that no one who is sick should be travelling right now. Just a reminder that we will be making available the sites of all our testing stations on the COVID-19 website if you would like to check where the nearest available testing station is. Also this weekend, the police will be highly visible in places people congregate, so in the vicinity of bars and restaurants across Auckland, in particular to ensure people are complying with current restrictions, including a 10-person limit on gatherings. They'll be there to remind us of the rules that exist to look after everyone as we have activity having opened up. In summary, a lot has changed across New Zealand in a short space of time. A New Zealander hopping off the bus in a mask, or tapping into a bakery by barcode, or giving a fellow Kiwi a very wide berth on the footpath is not something I would have thought would fill me with pride at the beginning of this year, but it does now. It's what care and kindness looks like. And I see people embracing it just like we did our new lexicon of bubbles, alert levels, being spaced out. And now we have new face mask chat to add in for good measure. It ensures that we can continue to step down through alert levels, build back a stronger economy and enjoy our level 1 freedoms once again. So, as we all head into this risky period that is a weekend, a few reminders of the tools we now have to lessen those risks. Masks or face coverings are mandatory on public transport and are also encouraged, and I see are being well worn, in public places in Auckland. Thank you, and please keep it up. If you go to a mall or shopping, or if you go out for a coffee, take your mask and join in on the awkward experience of figuring out how to manage it when you've ordered a hot drink. QR posters to record our movements are now everywhere we go, and people's use has improved immensely, with half of New Zealand using the app. Thank you, and keep it up this weekend too. And people are now able to see one another socially, but again, if you're in Auckland, keep it small. And if you're an Aucklander travelling outside of Auckland, please just hold to those guidelines wherever you are in the country as much as you can, of course, too. And so I say to New Zealand, your efforts continue to set us apart. You've been adaptable, patient and determined. This has all been critical to our Stamp It Out approach, an approach which will see our lives a little more normal sooner than we otherwise might. So let's double down our efforts and let's keep going. Okay.
Prime Minister, with the restrictions for Auckland, we said you were going to do a staggered approach, if you like, about 10 people to 100. Did you debate whether you should extend Auckland to come down to 2 rather than 2.5?
Yeah, there was some discussion, as you would expect, as to whether or not we kept those limits, those gathering limits where they are. There was really no real consideration of the idea of moving alert levels generally, though. That was considered generally to be in the right place. But yes, on gathering limits, but keeping in mind we've only had these gathering limits in place for roughly 5-6 days. That really isn't enough time for us to really be sure that we have got everything back on track and under control as we'd like. This gives us a bit of extra time and confidence. Keep in mind, this particular cluster really has spread through social gatherings, and that was something that we were very, very mindful of.
Debate about sectioning off the South Island to go down to level 1?
There was some discussion around that and the practicality of that. Keep in mind, of course, that there are those who are in the south who will have good reason to want to travel into the north as well. It's not just about the one way. So our first best endeavour has to be trying to make sure that we're containing the cluster in Auckland, and that's why we continue to have guidance around how we want Aucklanders to behave, but also risk mitigation, just in case we see it go beyond. That did happen in Tokoroa. We've been able to successfully manage that very, very well, but that's why we've kept those restrictions. Ultimately, we are a very mobile country. People travel a lot. They travel from the south to the north and the north to the south. The best protection is just keeping in place those risk mitigations of social distancing and caps on large gatherings.
Time we were in alert level 2, it was I think about a month until we moved into level 1. So should the country be preparing to potentially be extended for another 2 weeks beyond this new date?
Not necessarily. You know, our view very much was as a cabinet that it is just not the time for Auckland to see any changes there. It is a time to continue to keep extra layers of protection for the rest of the country as well, just as a precaution. But, of course, you know, we will, as we come in, use all of the evidence for the next cabinet to determine whether, for instance, the rest of the country might be in a place to see some changes next time.
What impact do you think lockdown fatigue might have on compliance?
Look, actually, it's been one of the conversations that I've had with other world leaders. Just the ongoing issue of that everyone around the world, and particularly New Zealand, we've been dealing with this since February. It is completely natural that people will feel weary. So we have to do what we can to make it as easy as possible to comply, set guidelines that accommodate as much of life as we can, and level 2.5 in Auckland, I think, does that. We're putting in place a limit that is manageable so people can have as much normal life as possible, but also we can keep them as safe as possible.
Briefings about the impact of Auckland moving from 3 to 2.5 and the ability then of Aucklanders to travel around the rest of the country, and how that's being managed given that you were asking people to basically take the 2.5 settings with them, even in different parts of the country, which was quite a new thing.
Yeah, it is. And look, ultimately what we're saying, first and foremost, if you're unwell, don't travel at all. Especially if you're in Auckland. But people should be staying home if they're sick, and not just from work, they should be staying home. So that's a very simple guideline. But then we're asking Aucklanders just to keep playing it safe. If you've been in Auckland this whole period, of course, in particular, if you're travelling out, just don't go to large gatherings. We can't enforce that because, of course, for the rest of the country, we do have different settings, but we can ask people to apply common sense and care. And that is something that we have asked with mask use as well outside of public transport.
Anecdotal, well, I presume it's anecdotal, but have you got any feedback about how that's working or the impact on other parts of the country or any...
I'll check in with Dr Bloomfield to see if he has, not yet, and I think it is fair to say that probably over weekends, you are more likely to have those kind of events. We have reached into those who might be, for instance, generally represent organisations that would hold conferences and the like, and just ask that they try and make it as easy as possible on Aucklanders with the holding of conferences at the moment, because that is another area where those social events that happen around conferences in our first cluster were quite risky and presented significant challenge. But having that health station at the airport, just with public health staff being made available, just a little reminder to people of what we expect of them when they are travelling. But again, as a country that does move around a lot, and not just Aucklanders leaving, keep in mind a lot of people have a need and reason to go into Auckland. When we are opening back up again, a regional border is just not feasible and workable at that place. So we have to put in other mitigations. On the anecdotal side, though, Dr Bloomfield.
Thanks, Prime Minister. So just a couple of comments. And first, just a reflection on this issue of fatigue and whether people are sort of disengaging a little bit. My sense is if we look at the incredible response around the uptake of the New Zealand COVID Tracer app, which now supersedes, I think, many other countries that have similar apps, as well as the mask uptake and the level of, again, engagement around that. I think, to me, that shows more that most people are very aware of and engaged with what they need to do, not just now, but actually that these might be things we're going to have to keep up for a period of time. The second comment I would make just around this second issue is that one of the advantages of having the rest of the country in alert level 2, which was our advice, that's appropriate to continue that, is this this size of group of 10 in hospitality venues. And so if people are travelling outside of Auckland, it's similar wherever they are in the country to what it is in Auckland. You know, people can go out in Auckland, they're in groups of 10 in hospitality venues, the same elsewhere. So the main difference is really these larger gatherings, and hence, you know, the publicity, the information that's going to be handed out at the airport, just to remind people to keep safe in that group size of 10 if you are in Auckland or travelling out. And, you know, I think, again, if we look at the engagement around mask use and about uptake of the use of the NZ COVID Tracer app, my sense is that many people are not only hearing the messages but going with them.
Just one last thought on fatigue, if I can. You know, I think one of the things that will compound that is if we ask people to do undertake certain actions or restrict their activity, and if they in the long term see no reward for that. I think one of the reasons perhaps we've seen the ongoing level of compliance that we have, which relative to other countries is still very good, is because New Zealanders have seen it pay off. It takes hard slog and a big effort, but they do see the benefit. They see restrictions lift and they see life resuming. And so that continues to be part of our strategy, put in that big effort of going hard and early, but ultimately see the gains from that in the long term. Sorry. Yes.
Speaking with other world leaders about lockdown fatigue, is Scott Morrison one of them, or could you just go to a little bit?
While I speak with him frequently, I don't think that that's a specific conversation I've had, although I'm always cautious whether or not I give away the individual details, but I have spoken with him frequently. I can't think we've touched on that, though.
Have you been speaking?
I think I talked previously with the likes Angela Merkel, and just some discussion over what was happening generally within Europe around people after travel and some of the issues there, and younger people, all things that have actually been canvassed in international media as well.
Europe's had quite a resurgence in Spain and France, and is that part of that lockdown fatigue?
I think there's a range of issues there because, of course, we have a different strategy than Europe. And so they're, of course, trying to make sure that they don't see these large, waves that overwhelm health systems. But we have a stamp it out strategy, so quite different. But all of it requires, though, a level of control and making sure that you don't have a health system that is overwhelmed. And you will have seen in international media some discussion over whether or not, with the outbreak, particularly amongst young people overseas, whether or not there's been an issue of compliance for those who have perhaps seen a lesser health impact from COVID.
So when was that discussion with Angela?
I think I might have mentioned that maybe a week or week and a half ago. Something like that.
Do you expect Auckland to need to go to a full level 2 before the whole country moves to level 1?
Actually, I wouldn't want to predetermine any of those decisions. We haven't said, for instance, that we have an expectation of aggregate settings in that way. We consider each on its own merits at the same time. What I would imagine that Cabinet would like to do at the next alert level setting, assess the risk that exists within Auckland itself. That will then demonstrate the likely knock-on risk via regional travel. So if Auckland's looking good, that should then have a benefit, a positive knock-on.
Prime Minister, you were able to visit the Fono, the Pacific Island service provider in Auckland yesterday. What's the morale among frontline staff and the mood among the Pacifica community?
My perspective, it seemed very high. For instance, while I was there, I had a chance to thank those who were part of providing welfare support and care. They were in between deliveries, working with families. They talked about the sheer scale of the number that they were working with during this particular resurgence, and talked frequently about the improvements that are being made to the systems that were being used now, relative to even what we learnt in the first wave. And so I was incredibly grateful, but also so impressed with the work that had been done and the commitment to the community.
So in terms of...
It's less than a month before New Zealanders vote in the election, so I'm just wondering, obviously some of these decisions now will creep into closer to the election. How will that affect your decision making? Will you bring the opposition involved? Will you consult more heavily? Does it change anything from your point of view?
No, I mean, as I think I've spoken to before, New Zealand only takes on a caretaker convention in the aftermath of an election. And so that's a period where, until there is the Governor-General, of course, has the confidence that a government can be formed and that official process takes place. It's from election day to that point that we have caretaker conventions in place. Up until that point, the government continues to govern. And so we will do that. Obviously, you will have seen that in my decision making. I've been mindful of, for instance, issues like the setting of the election date. But we still have the job of maintaining our COVID response, and it's been based on evidence and science rather than politics.
This decision will upset a few people. I'm thinking of South Islanders, business.
Yeah.
ACT today put out a press release saying every hour costs $2.7 million to the economy. Are you keen to see this remain?
I'd say the flip side is that any hour that you're in a level 3 is even more expensive, and we all want to prevent that.
Stay out of the political campaign, given you say you're making these decisions on science rather than...
Look, political parties will take their own view. They'll take their own view on measures around public health. They may take their own view on recovery and rebuild. All that I would urge is that we try and, as politicians, be consistent around public health messages. So encouraging people to get tested. And even if you have a difference of opinion on the rules, I would hope that politicians would still encourage people to follow those that are in place and being enforced, because they are there ultimately to keep people safe. And I hope on that we are on common ground. Jessica and then Toby to Dr. Winfield.
Is it appropriate, though, for you and other politicians to be flying all over the country with groups of people at this time, when Auckland is still getting these community cases?
So keep in mind, of course, what we're saying to Auckland is we're acknowledging that Aucklanders can and will move. We're just asking them to be careful as they do. And so, of course, for instance, whilst I've been based in Wellington, I have moved in and out, and when I'm in Auckland, you'll see that I exercise as much caution as I can, face mask use, social distancing, and so on. And so for those who are in Auckland, we're just asking them to apply that care and caution when they're outside of the area, as well as when they're in.
Because, I mean, with politicians and the leader of the opposition as well, you guys are meeting with large groups of people. Is there the risk that politicians could become super spreaders?
And that's why, we have to apply those same cautions that we're asking of other people. Keep in mind the mass gatherings and social events in Auckland that we're limiting to 10 in Auckland, that isn't workplaces or education facilities. What we know about those gatherings when they're dangerous is when they are groups of people who know each other well, who are familiar with each other, who are less likely to apply social distancing. So that's why we saw spreading at weddings, stag do's, conferences where people were mixing and mingling over drinks. Unfortunately, of course, that is why we've had restrictions on weddings and funerals. Those are the events that are very risky, and that's why we keep those limits at 10 in Auckland, and we've kept a cap elsewhere as well.
How important is it to see a run of 0 cases before you recommended to Cabinet shift down alert levels?
So rather than 0 cases per se, and this is community cases, we will keep getting cases in managed isolation. Again, it's the expected versus unexpected cases. And for example, the 3 cases today are all part of the sort of Mount Roskill evangelical church grouping. They were already in self-isolation. They were known close contacts. So that in itself doesn't present any additional risk to the community. It may be that it's some time while we still see these cases, low numbers of cases, so it doesn't need zeros per se, which is what we had last time. Actually, we had quite a run of 0 cases when we were in a different situation. But one thing we are going to continue, both in Auckland and around the country over this next couple of weeks, is the high rates of testing and surveillance testing in the community, not just testing people with symptoms, but also looking at specific groups who are asymptomatic, who may have been in contact with Aucklanders travelling outside of the region, for example, those in the hospitality industry, in the travel industry, and the tourism industry, just to make sure that, again, there's no spread outside of Auckland.
Is there any chance that we'll shift down to level 1 before September the 16th?
No, we've obviously set in place that is the next time that we will be reviewing those settings. But again, it doesn't necessarily mean that when we next consider those settings, that the whole country needs to be at one alert level. We will be open to considering some variation therein, very much depending on the risk that we see from that current cluster. So we are open to considering that.
Dr. Bloomfield, on hospital flu admissions, why do you think we've seen such a drop this year? And has it translated into has the trend been the same for other respiratory conditions?
Yes, actually, I was listening to a program yesterday on the radio about this, and those more severe sort of respiratory conditions during winter, so influenza, and also RSV, respiratory syncytial virus, which tends to be more in children, much lower levels and lower rates of admission. So I think so far around the country, a few hundred admissions related to flu, whereas in a normal year that would be several thousand. I think last year around 6,500. Not unexpected, and it goes with the much lower rates of influenza-like illness we are seeing out in the community, being reported in general practice, and it almost certainly reflects the fact that during the lockdown earlier in the year, which is the time period when usually flu viruses would be being imported from the Northern Hemisphere, we weren't importing them. And so that's been, I think one of the sort of benefits of that lockdown has been that we haven't had that extra burden of respiratory illness on our hospitals, so it's allowed them to do the catch-up work for the elective work, the planned care, and also has taken the pressure off so staff could be freed up to do some of the testing work that is being done, particularly around the Auckland region.
The New Zealand Medical Journal today, there was a report that found severe inequalities in how COVID affects different ethnicities, specifically Māori and Pacifica. They also say it's exacerbated by racism within the healthcare system. Is that a fair characterisation?
Well, I think they're two very closely related issues. The paper was some modelling work that shows what would happen if we had the higher rates of infection here that other countries experience. And we know for a fact that Māori, Pacific and older people would be harder hit, in part because of the higher rates of pre-existing conditions, and those are the people that have worse outcomes. This was one of the key drivers of our decision-making or our advice and Cabinet's decision-making, I think, earlier in the year, and indeed with this outbreak, to act very quickly to protect those populations. Moving to the issue of racism, institutional racism in the health system, and indeed more widely in other services, this is a known issue. It's been identified also through the Health and Disability System Review. It was a strong theme there, and through the Y2575 inquiry. And it's an issue that I really feel the sector is engaging with and addressing, because we're all committed to this ensuring equitable access to experience of and outcomes from care.
Those populations, those demographics are more vulnerable, as you just said. Is that one of the reasons why the hospitalisation rate for this current outbreak is twice what it was?
Yes, it certainly is. I mean, it's a different age group, so that older than the group that was mostly affected earlier in the year. But also, yes, we know that more of the people in this cluster, in fact, the predominant ethnicities are Pacifica and then Māori, and they do tend to have higher rates of pre-existing conditions, and that will be a major contribution to the higher hospitalisation rates.
To clarify, you mentioned that case just before the 2.5 came in was the last sort of unconnected case that we were concerned about. Is that the last case that we've had that was in the community where the people weren't already in isolation? And was that the person who presented at the North Shore PD?
No, that was some time earlier. I'll leave Dr. Bloomfield to give the public description of that case, but my recollection is yes, that's been the last unlinked that we've had. But
yes, that is the case, and we're sort of describing it by geographical location, which is in the botany area of East Auckland.
Yeah.
I'll
come to Gina Thomas.
So is it fair that taxpayer money is going into a Labour Party account because of the deal that you've struck for your Hutt South elected office?
So obviously what you're referring to is the fact that we have a building in the Hutt where an MP has an office. That is costing, and of course across the country we maintain electorate offices. That particular electorate office is costing the taxpayer, I believe, $6,000 a year. That is certainly at the cheaper end of the scale. Of course, there is a historic arrangement around that lease arrangement, but all of that has been, I'm advised, within the rules of parliamentary service. Is not unlike some of the other arrangements that may well exist across the board within Parliament.
$1,000 a year when it's only costing you $1,500 a year.
Essentially, at the time that the building was sold, there was an arrangement made between the two parties, between the Labour Party and the Union, which has led to that arrangement. Ultimately, what has to be factored in from parliamentary services is, does that represent good value for money? Are the taxpayers being asked to pay more than what would be considered a commercial lease arrangement?
The Labour Party still making money out of the taxpayer.
There will be scenarios, as I understand, where some parties own buildings as well. What we have to make sure is that it's an arrangement where no one has been charged anything above what would be considered fair and reasonable rent. That wouldn't be right. That's for parliamentary services to determine, though.
Face of it, is it fair?
Ultimately, I think what we have to make sure we're doing is never creating a situation where taxpayers are paying more than what is fair and reasonable market rent. And that's what parliamentary services are there to consider. That's not what I am here to do.
Have you asked whether other electoral officers are using a similar arrangement?
I know that across different political parties, I believe that has happened in the past. Many have, of course, sold buildings over the years, but I couldn't tell you off the top of my head how widespread that is.
Given
there will certainly be other cases, I imagine.
Would you undertake to ask your caucus whether they are aware?
For me, the most important thing is that we are applying the rules. We are sticking to the rules set by parliamentary service, and that is, of course, what we are obliged to do.
That this might be an undeclared donation of a gift to the Electoral Commission.
Yeah, so I've seen that question raised. That would be for the Electoral Commission to determine. I wouldn't want to make any predetermination on that. That would be for them.
Review those cases if there are those contracts if there are other cases, just because of the way it looks to the taxpayer that the Labour Party is making money out of public money.
Again, $6,000 for the renting of a space. What I'm concerned about is always making sure that we have to apply the rules here. We have to make sure that parliamentary services are in the position to make sure that everyone across the board is applying those rules, and that we are not seeing a situation where taxpayer money is being used, therefore, inappropriately in that regard.
Yeah. It's been 2 weeks since the Health Minister said that the rules were going to be coming out regarding testing and isolation for aircrew. What's the hold up there, and how much pressure?
There are some there are ongoing discussions with Air New Zealand. The implications of some of those rule changes are reasonably significant, particularly for freight. So we do need to make sure that for freight, where there may need to be separate arrangements, that we get those settings right. I expect in the early days of the early part of next week, we'll likely then have that final order drafted. But ministers are still working very closely with Air New Zealand on those.
Pressure are the airlines putting on the government to keep the rules as they are?
Oh, it's fair to say that we see our job as keeping all of New Zealand, and we see our job as keeping aircrew safe as well. And so that's our focus. We absolutely accept that we need to keep lines of travel and freight open too. But that will continue to be our focus in our conversations with airlines.
Botany grouping seems to be quite well contained. There was 5 cases and 42 identified contacts, all of whom have been identified.
Yeah.
Is that fair to say that it appears to be quite contained?
We're hopeful it's well contained. It's just that it's appeared quite late, so several weeks after the first cases in this outbreak. And so what we're looking to do, of course, is there's a genomic link to the overall outbreak, but we're wanting to go back and look and just see, are there some missing links in the chain of transmission through to the start of that small sort of subcluster, and that's what we're working on at the moment.
So people in that grouping, I guess, that you're still trying to find?
Not that we're trying to find, just the public health unit's working very closely with them to get further information, just to try and sort of fill in the missing bits of the puzzle as to how the first person in that small subcluster might have become infected.
Yeah. Okay.
Botany case, the Church mini cluster, and the North Shore case, which have been genomically linked but not epidemiologically linked to the main cluster. The concern there is that there might be these missing links of transmission who have gone on to infect others who haven't.
Yeah, and we had the doctor as well very early on. Yeah. So those are the examples of why we want to apply a cautious approach. It's not to say we haven't had clusters before where there has been an inability to find the human-to-human link, and we have still been able to contain those. But it does give reason for caution, and that's why things like mask use are so important, those gathering restrictions, and keeping the settings where they are, because those are the things that really just say to us we need to be careful.
Prime Minister, Otago University's come under fire for its admissions policy with regard to the medical school, Māori pathway into medical school. Are you happy with, I guess, what looks like an affirmative action policy? It seems to have been quite successful in diversifying admissions, but people have taken umbrage with that. Do you have a view on whether or not that's a good thing that the university is doing?
What I'll say, if I may, while I haven't been briefed specifically on that example, I would say the same thing about diversity in our medical profession as I would about, for instance, diversity in Parliament. That we have a duty to make sure that we represent the communities that we are here to serve, and that there are a number of reasons why historically often groups have been poorly represented in this place, and that in order to overcome that will often take proactive policies and changes in the way that we do things to improve that representation. And I think that there are many examples where that is the right thing to do.
Put that to you, Dr. Bloomfield, as well, the Otago University admissions platform.
Two comments. First of all, when I went through medical school, which was quite a long time ago, in the 1980s, there was already a scheme in Auckland Medical School, MAPAS, which was Māori and Pacific Admissions Scheme, that recognised the need to support and proactively ensure that Māori and Pacific students were not only admitted to medical school but actually supported through to qualify at the other end. There is no doubt that these groups are underrepresented in our medical workforce around the country, and I might say that that scheme in Ōtākau also includes a rural stream as well, recognising that actually there is a need to ensure that students from outside of the main centres are able to both get into medical school and then are supported to go through. And there's a very good reason for that, is because in all three cases, Māori, Pacific and rural streams, these are the people who are more likely to go and work out in their those communities again and provide the sort of care that that actually works for those communities. And there's no better example of this than actually over the last 4 weeks in Auckland, where we have seen it's been actually quite eye-opening, the importance of the Māori and Pacific health professionals and providers in engaging with these communities who have been the ones that have had COVID-19, that have been part of this outbreak, and how successfully they have been able to work with those communities to not only meet their needs, but to identify the contacts, both close and casual, to actually help contain the outbreak.
Okay, last couple of questions. I'll come to Jessica and then Justin.
What do you mean when you say eye-opening? Isn't that something you already knew before, that people feel better being treated by people of a similar community? Is that can't be something that's new to you, though?
It's definitely not new, but I mean it's just been striking, and it's one of the things that, for my part, I've really taken out of the one of the key lessons out of this out of this outbreak over the last few weeks. And I think it just reinforces the importance of making sure that we are providing services across the health system that include both kaupapa Māori and Pacifica services, and we have providers that are able to reach into and engage with and support the health and well-being of these communities.
Last question, Justin.
There's been warnings of the long tail of this Auckland cluster. About 1/3 of the cases now are in the Mount Roscoe subcluster, and when you add in the Botany one, we're getting closer to half. Are you expecting that the proportion of cases in those newer clusters is going to increase with time, and does that extend the tail?
Well, without wanting to try and predict the future, we would expect, because those are clusters that have come later, or subclusters that have come later in the outbreak, we would expect those to be the cases that continue for the longest period. I'll just go back to a comment I've made over the last few days, that is that because there is this opportunity now for people to, and for cases and their families and whānau to go into a quarantine facility, that reduces the transmission within households, which again we are still seeing is where most of that transmission happens. And indeed, the 2 cases in managed isolation today were also within a family unit. So I think that will help reduce the length of the tail here, and that's I think already applied to those sub-clusters that appeared early on, and I think the same will happen for these latter groupings, both the Mount Roskill Evangelical Church and the Botany one.
Right.
Botany, is it like connected to a healthcare setting?
I do believe that
like
is
one household. Or?
Jumping slightly outside the bounds of last question. I'll let you away with it, Derek.
Yeah, there is a number of households, and again, the public health unit is just characterising that. But the key thing is that the cases have been identified, close contacts are in isolation, being tested.
Okay, thank you, everyone. Have a good afternoon.
And now featuring Petal Search, your gateway to a million apps.